Yes, good morning, Mr. Kelly. If you campaigned on repealing the health care law, wouldn't you be true to yourself and those who supported you to reject the federally funded health care you will now enjoy as a congressman, but is willing to deny others? And if you're going to be true to yourself and those who supported you, wouldn't you go and just buy private health insurance instead of the federally funded care that you will soon now enjoy?
We'll get a response. Thank you.
Yes, Valerie, and thank you. And I got to tell you something. There's no reason for anybody to get anything different than anybody else. I personally have always paid for my own health care, and I have health care for the folks that work with me, the associates that work with me. Look, we know that health care is important, but we also know that certain people get certain perks and privileges. I'm telling you right now, I'm a guy that says this. Look, I don't think anybody should be given, they'll use the term Cadillac plan, which I'm okay with the term Cadillac, but you know what? Why? Why should my pension as a public official be any different than anybody else's pension? Why should my health care as a public official be any different than anybody else's? No, level it across the board. I will tell you right now, I do not want a special pension or a special health care program that isn't the same for the people that live in this country. I think that's flat out wrong. I think it sends the wrong message to folks. And I would tell you this, on my part, I don't need that. I've always paid my own way. I can pay my own way, and I am with you. No, I don't think any public official should get something over and above what the average American has. It's
so
crazy.
Will you have the congressional plan?
No, I don't need. I got my own plan. I don't need a congressional plan. I've taken care of myself for a long time. I didn't come here for health care. My health care. I didn't come here for a pension plan. I didn't come here for the pay, by the way. People ask me, do you know how much you're going to make? I said, no, I really don't know how much I'm going to make. And that wasn't my concern. It wasn't how much I was going to make. It was how much I could bring to the table and what I could do to try and make a difference and get things fixed. So I know those are items that other people think about. Listen, I've had to do it on my own. I've never had anybody pick up the tab for me. I never expected them to, and I certainly don't think that the American taxpayers should be paying for something over and above what they would have to, that they could afford themselves. So I'm on board with that. I think that the congressional health care plan should be the same as everybody else's. Why? Why would it be any different?